Good morning, class. So today I'm going to go over alginate impression of materials. I know we talked about it in class, but I need you to have some type of visual of what I was talking about. So we're going to start with the materials that we need in order to take impressions. We have our alginate impression material. We have our water measurer. We have our scoop to get the powder. We have a mixing bowl, a spatula, as well as a tray. Now these trays are disposable and you will pick one according to your patient's mouth. So you need to check your patient's mouth prior to placing it to see what size they may need, and you need to determine whether or not you'll need a mandibular tray or a maxillary tray. How to know the difference? Mandibular tray has a no center area, right? Because what's going to go in between here? The tongue. The maxillary tray has this area, middle area. That area will lay against the hard palate. Okay, and that's how you will know. Also, you can always check the bag. A check mark will be placed next to the size and type of tray you have on the front of the bag. So let's start with first step. Now, before you open your alginate impression material, you're going to want to shift the material like we talked about. That is to get the material unsettled so that you can get a good amount of material and it's packed and it comes out properly. Also, remember, alginate impression of material is a non-hydrocolloid material. So that means it will not break down with water. Therefore, you are required to wear PPE with it. So I have my goggles on. I will now put on my mask. And also complete hand hygiene and place my gloves on. Now that I have my PPE, I am ready to start the process of mixing alginate material. Here is my alginate material. And this material is a regular set. So remember, with a regular set, I will have 4.5 minutes to work and place and get my alginate material in the patient's mouth prior to it completing setting. I will be using the maxillary tray. With the maxillary tray, you're going to want to use 3 scoops because you need a lot more material. When placing your scoops, you need to make sure you level off the material just as if you would when you're baking. Once you are complete with gathering your alginate impression material, make sure that you close the container. The container should not stay open while you're working throughout the process. Now that we have 3 scoops of powder, we're going to need equal amounts of water. And the lines on the cylinder has your points where you're going to fill it. So we're going to fill it all the way to the top, and you see 3 scoops of powder. And this gives you your third line for the water. When gathering your water for your alginate material, remember what things causes that can change the setting time for alginate material: the temperature of the water, the temperature of the room, the patient's mouth. So you want to ensure that your water is not too hot or too cold. So usually a lot of experienced techs will take the water, get it first, and place it to the side so it can become room temperature. That is just an FYI. So now we're going to start the mixing process. Water added to powder. This can be very messy, so you have to not only work quick, but try to contain it. As you can see, you have to be a little rough. You can't kind of... I know somebody out there is timing it. Now that I have my material in my tray, I will then go to my patient that has their PPE on, pull their cheek back, come in at an angle, stand behind the patient, and ask the patient to lean forward. Hold the tray in place and wait until my material is set. A good rule of thumb is to apply some of the material to your glove so that you know when it has completely set and you can remove it from the patient's mouth. And you just check it ever so often to see if it has hardened. It's not quite there yet.
HM2, what kind of position want the patient to be in when we're doing impressions? Do you want the patient to be laying down or sitting upright?
So when you're taking impressions on a patient, you want that patient sitting upright because you do not want the alginate material falling to the back of the patient's throat. So you'll have the patient upright and leaning slightly forward so that they can keep the material from going down their throat. Okay, it looks like our material has set. You're going to take your finger, you're going to go inside of the patient's cheek, up to the top of the tray, and pop it loose. And then you will bring out the tray at an angle so that you do not injure the patient trying to take the tray out. And you have your alginate impression of the maxillary arch. Thank you guys for watching.